Good morning and good afternoon, everyone. My name is Sofia Cortes, and I'm a Senior Program Coordinator at Banyan Global based in Washington, D.C. Banyan Global is a woman-owned small business founded on the principle that integrating expertise and experience from the development community and private sector will achieve a broad and lasting impact. Banyan Global works across multiple practice areas, including health, gender, and youth. Banyan Global honors the contributions of youth and has implemented many youth-focused programs, including the USAID-funded Honduras Workforce Development Activity and the USAID-funded Recycling in Jordan activity. Banyan Global is very pleased to welcome you to our third annual International Youth Day event. Each year, the United Nations announces that a theme that allows collaborators to rally around a specific topic. The theme of this year's International Youth Day, Intergenerational Solidarity, Creating a World for All Ages, will work to amplify the message that action is needed across all generations to achieve the Sustainable Development Goals and leave no one behind. In 2012, USAID released its Youth and Development Policy. USAID was the first bilateral donor agency to release such a policy. This year, USAID updated that policy. The vision of the updated policy is a world in which young people have the agency, rights, influence, and opportunities to pursue their life goals and contribute to the development of their communities. The goal of the policy is to increase the meaningful participation of youth within their communities, schools, organizations, economies, peer groups, and families, enhancing their skills, providing opportunities, and fostering healthy relationships so they may build on their collective leadership. As an organization, Banyan Global acknowledges that everyone has something to contribute, no matter their gender identity, their religion, their nationality, or their ethnicity or age. In light of this year's theme, Banyan Global thought it was appropriate to highlight our work in Nigeria under the USAID-funded Health Workforce Management Activity, or HWM. The HWM activity is a 5-year project to support the establishment of a cost-effective, well-trained, and motivated health workforce, particularly in targeted rural and remote areas of Bauchi, Ebonyi, Kebbi, and Sokoto States, as well as the Federal Capital Territory. Nigeria is home to one of the youngest populations in the world, with a median age of just over 18 years old. It is also home to one of the 57 countries faced with the critical shortage of healthcare workers. Together, these facts mean that there is an enormous potential for the country to develop its human capital and train the skilled healthcare providers needed to serve its growing population. Today, we are joined by students and future healthcare workers representing HWM target states. They will engage in a moderated discussion led by HWM's Ebonyi State Human Resources for Health Coordinator, Uchenna Ebenezer. Specifically, the panel will examine issues of particular importance to Nigerian youth, including healthcare worker recruitment strategies, hardship post requirements, brain drain, and the social norms affecting their decision whether or not to join the healthcare workforce. As a reminder to all, this event will be recorded and made available to our audience in the future. Thank you especially to all our panelists and moderator for being here, and we look forward to what I'm sure will be a very enlightening discussion. Passing it on to you, Chair.
Thank you, Sophia. And I want to welcome everyone to this program. All the way from USA, all the way from Nigeria, all the way from all the states working for health workforce management, Ebonyi, Kebbi State, Bauchi, Sokoto, and the FCT. I welcome you all to today's program, and we're going to have a wonderful time with all of our students, all of our future health workers joining us from these various states. So to give a bit of the background, we're going to look at some of the perspectives of human resources for health across all of our states. And joining us will be student nurses and midwives and student community health practitioners from Kebbi, Bauchi, Ebonyi, the Federal Capital Territory, Nigeria, and Sokoto. And just to let you know that these states are are not contiguous states in Nigeria. For example, Ebonyi is in the southeast of Nigeria, predominantly Christians and of the Igbo tribe. And also we have Bauchi, the FCT is in the north central of Nigeria, and predominantly a mix, a cosmopolitan city, so we have a mix of Christians and Muslims in that area. And also we have Bauchi, who are predominantly Muslims, and we also have Bauchi is in the northeast, Kebbi is in the northwest, and Sokoto is also in the northwest. And then they are predominantly Muslims. And our cultures are different. So the cultures in the southeast of Nigeria is also different from the culture that we see in the northern areas. However, the northeastern zone, the northwest zone, and the north central zone have some similarities in their culture and the way they view gender perspectives. So we're going to have a very interesting discussion this afternoon, looking at these perspectives from our young people. And I'm glad that all of them have joined and they're all sitting together. So we're going to have a wonderful discussion. So thank you, all the HWM staff that have joined us and all of the friends of Banyan Global all over the world who have joined this program. I appreciate you, and Head Workforce Management also appreciates you. And we know we're going to have a wonderful discussion at this point. I also want to recognize the country director of Health Workforce Management in Nigeria, Andy Omolabi, and our technical director, Olufolake Akeju, and the rest of the team, and Jason from the team in our home office. I welcome all of you. So some of the issues we're going to look at, our topic says youth perspectives on human resources for health in Nigeria. And so some of those perspectives we'll be looking at include barriers to health services, how our students view it as future health workers, and also as recipients of also of the health services that are being provided in the rural and remote areas. And to remind us also that these, our students, most of their schools are located in the remote and rural areas, you know, far places, and that is where we have the women and children in Nigeria who actually require health services. We're also going to be looking at what are the issues related to internal migration of health workers across cities in Nigeria, and also external migration, as we see on record that a lot of Nigerian health workers are outside the country. We want to see the perspectives of these future health workers and whether they will remain in Nigeria to serve the women and children in these rural areas, or whether they will migrate to other countries. We also look at the socio-cultural issues and the gender perspective related to their choice of career. Why did they really want to become nurses and midwives? Why did they really want to become community health practitioners? We also look at e-learning, and then with the COVID-19 and all of its acceleration for e-learning, what have been their experience? What do they want to see in the future regarding e-learning in these schools where they are, noting that these schools are in the rural and remote areas? I'll also be looking at the issue of bonding. For example, where the students are provided with scholarship and some sort of incentives, would they be willing to stay back to serve their communities? These are the issues we'll be looking at, these 5 major issues as we do this program this afternoon. So once again, I welcome you all, and we're going to start immediately. So the first issue we'll be looking at will be the issue of internal migration of health workers. Like I said earlier, our speakers are essentially students. They will be future nurses and midwives, and they will be future community health practitioners. I want to ask them what they feel about the internal migration of health workers from the rural areas where they have been trained to the urban areas, and also the external migration of health workers from Nigeria to other countries of the world. So I'm going to ask FCT team, please, can you respond to this question about your perspectives on internal migration and external migration of health workers? FCT team, please, can you start this session, please?
Sit down. Okay. Good afternoon, everyone. Good day, everyone.
Good afternoon.
I'm Sheyi Badmus from FCT. So looking at the topic on the brain drain, the internal migration, we all know that the internal migration is the one that is happening within the country. For example, in Nigeria, we know most people want to move to the developed parts, like in the cities where the old Bozo is. So everyone wants to go to FCT, the main city, not the rural part of it. And people want to go to Port Harcourt and Lagos City. So this migration, the perspective of people moving into those areas will cause the workload on those that are in the rural area to be more, and there will not be effective care given to people in those rural areas. Then that way, there will be people that will be patronizing the healthcare services that might affect their health. For example, we have issues of people going to traditional birth attendants and people going to the bone setters. So where does the healthcare team, the doctors, the nurses, and the community nurses and midwives come in to come and provide the care that is needed for the people in the rural area, where we know we have more of the maternal deaths and the child deaths in the country? So
yeah, exactly. Yeah, we have that. So we have more of the maternal and child deaths in the rural area. So can I hear the perspectives of Ebonyi State and thereafter Bauchi about, health workers moving out of the rural areas to the cities and moving out of the country? So I'm going to ask you, as future health workers, will you leave the country? Will you leave the city where you have been trained to serve? Team Ebonyi, please respond.
Okay. I'm by name Olufolake, the student of Community Health Department at Ebonyi State College of Health Science and Technology. The issue of migration as related to health workforce is really an issue that is triggering a lot of problems in our countries today, because people have the interest of seeking for favor in the developed area, where we as a community health practitioners are based on seeking for or bringing healthcare services to those living in the villages or the rural settlement. So migration tends to leave those that we ought to give promotive, preventive, and rehabilitative, even curative healthcare services at the rural level, and leave them with the burdens of diseases that affect their life. Then, as a result of that, the maternal and child mortality are ravaging the rural settlement. So leaving your settlement or going to fend for your living in a town is not actually encouraged as, for me, as the community health practitioner, provided those necessary resources that makes me feel self-reliant and self-determined are provided in my rural settlement, that can enable me as a health practitioner perform all that I have to do or carry out to ensure that services are rendered to humanity. Thanks.
Yeah, so Team Ebonyi, I hear you. You talked about the burden of diseases in the rural areas. You also talked about, the health workers being well equipped so they can remain in the communities where they have been trained to serve. Okay, that's wonderful. And I want to hand over to Team Bauchi. Team Bauchi, please, can you respond? What are your perspectives about the internal migration and external migration of health workers?
My perspective on this issue is, I think this internal migration of healthcare workers from urban areas to rural areas is causing some effect, and these effects are negative. Some of these effects include imbalance in the concentration of healthcare workers in the villages and also in the city. You'll find out that there are many healthcare workers in the city, but when you go to these urban areas, you realize that there are only few healthcare personnel, and these healthcare personnel are not well equipped with the things that they need, and also they are not that skillful. You realize that the people in the urban areas are suffering from the people in the rural areas are suffering from different kind of problems. And while in the city, you find that there are many people and the conditions there are less. Another problem that this issue of internal migration is causing is the aspect of interference with the functions of the healthcare facilities in Nigeria, because the healthcare facilities in Nigeria are categorized into three: the federal government, as the tertiary, the secondary, and the primary. The rural areas are more concerned with what we find in the rural areas are the primary healthcare facilities, and they are more concerned with treating issues or problems identified at the grassroots using the available resources. If there are not enough healthcare personnel in those rural areas, you realize that the functions of the secondary and tertiary in the city will be affected because people will keep on being referred to the city, and the city cannot be able, those in the urban areas cannot be able to focus on their function of higher level of care. They'll have to come back to these issues that have been left by the primary healthcare centers and be treating them. Another
excellent. I think that's fine. Excellent diagnosis of how the internal migration affects, you know, the functionality of the health facilities across the primary, secondary, and tertiary level. Excellent diagnosis, wonderful. So thank you so much. We're going to move, so Team Kebbi and Sokoto, I'm going to give you the opportunity to respond to the next question we're going to look at, looking at the choice of career. And like I said earlier, these students are future nurses and midwives. They are future community health practitioners. And I'm going to ask them, why did they choose to become nurses and midwives? Why did they choose to become community health practitioners? Were they forced by their parents? Was it the culture of the community that, you know, persuaded them to become these future health workers? What was it that made them to decide to go the path of this profession? So I'm going to give Team Kebbi the opportunity to respond first. Team Kebbi, please, can you go ahead and respond to the perspectives about your choice of career?
My name is Fadila Mbel from Kebbi State College of Nursing and Sciences, Banyan Kebbi.
Thank you.
Why I choose to be a midwife is because I wanted to be, I have the passion for it. I have the passion for it, and I always wanted to help the people in my community. But nowadays, the primary health care there in the communities are not well utilized, especially by the people in the village. The people there in the village, and we, the health workers there, we aren't specializing. We are not really equipped. The equipment there are not well used because the people there too, they are downgraded, that they look that they don't want to go to the health facility. Some don't have the means of transportation. Some don't have the fund and the equipment there. If actually we really want to work there in our community, we need to be equipped so that the way we have been taught in the school, we should go there and practice it wisely.
Thank you, Team Kebbi. But I wanted you to tell me why you chose to be why you chose to become a nurse. That's the question I put to you. So tell me, why did you decide to go this part of your career?
I have the passion for it.
Okay. So you were not forced to do that. Your parents didn't force you. The community didn't encourage you. It was a personal decision.
Yes,
Kebbi,
probably. My dad is a health practitioner. I always wanted to be a health practitioner because I always used to see him practicing it, especially in our home. When one of us is sick, then I just choose to be, me too, I wanted to be one of the health practitioners just to know how to do those things.
Oh, excellent. Okay, so Team Sokoto, we're still looking at the perspectives of why we chose to become community health practitioners and community nurses and midwives. Team Sokoto, please, can you respond, please? Team Sokoto, please.
Okay, my name is actually Joy Udefi, and I'm a student of School of Midwifery, Sokoto.
Okay.
My career, I was not actually forced to be a midwife. It was something that I just have this passion for. Different factors actually contribute to becoming a midwife. What I initially wanted to pursue was actually medical radiography, but I actually realized that being a radiographer will not actually keep me in close contact with my patient. And I will not actually know my patient like the way I'm supposed to know the patient in order to diagnose the condition of the patient, to provide the require treatment and actually implement and evaluate the patient's care in the order at which I'm supposed to take care of the patient. So being a nurse has actually been something I had always wanted to do. Being someone that is having I'm very caring and I have compassion, so I try to actually place myself in people's shoes, and this has actually will actually help me to like be able to care and cater for my patient the way I'm supposed to. I think this is actually what actually motivated me to be a midwife, and this actually
wow,
a privilege to be at the birth and beginning of life. That's midwifery, receiving of the baby, and actually at the end of life where you have encounter with the patient. I think it's a privilege to actually be a nurse. I think these are the reasons.
Thank you so much. Thank you, Joy. So I'm going to move to Team Ebonyi again on the perspectives of why you chose to be either a community health practitioner or a nurse midwife. So Team Ebonyi, please, can you respond? Team Ebonyi, just go ahead, your name and your school.
Okay. My name is Gospel N from Ebonyi State College of Health Science and Technology. Well, the reason why I love being a community health worker is I am very passionate about it. I was not forced to go into this. It's not as if I see others going to do community health that drive me to do this. It is what I'm passionate for. Like, I love helping people that are sick. I don't like someone seated beside me to complain that he or she is sick. I love to save life, even with the little effort of mine. And again, coming to the health community, it is what other health workers as a neglect, like helping people at the grassroots level, bringing primary health care, like giving meaning to primary health care. It is what most health workers neglect that the community health workers do. Like in the rural area where you bring life, as in you save life, bringing service to people where they live and work, no minding the stress that is involved, no minding what it took, but at least saving life on the grassroots, making people to be sure that they are free from certain diseases. So for me, being a health worker and mostly a community health worker gives me a very great joy. I am not regretting today that I did not write jam. Even till tomorrow, I'm still proud of my profession. Thank you very much.
Wow. Yeah, that's the beginning point, being proud of what you have chosen to be. Thank you so much. Thank you so much. I'm going to ask Team Bauchi finally on this question, the perspectives of why they chose to become either a nurse or a community health practitioner. Team Bauchi, please.
Thank you very much for this opportunity. I'm Uchenna from College of Health Sciences, HWM Technical. And what prompted me to come into this profession is because of mostly the uniform. I fell in love with the uniform at first sight, and especially the Nightingale cap. I just love it. My neighbor used to be a nurse, so it was beautiful. It was really beautiful. Then coming into the profession, I got to understand a lot of things. I'm a midwife, a student midwife, and then the joy of conducting deliveries, when you listen to that first cry of babies, when you see them come to life, and the joy and the passion is what's keeping me in the profession. And I am not really regretting. I've never come into the profession. And then thank you very much. That's all I have to say.
Yeah, thank you. So the uniform and the cap was the first attraction. Wow. Okay, keep it up, please. So Team FCT, wow. Team FCT, yeah, I want to go to Team FCT. Let's discuss ICT and e-learning, okay? So as students who are in the colleges of nursing and midwifery and also community health practitioners, I want to find out what is the current situation with e-learning? What has been your personal experience? Where would you want the e-learning experience to go forward in your school, even in your own personal efforts? And COVID-19 has exposed our tertiary institutions in Nigeria to the beauty of e-learning and also to the advantages of e-learning. So I want to hear from you. How has it been for you? What do you want to see going forward with your tutors, with other students, and even with yourself as a student? Please, Team FCT, please go ahead.
Good afternoon, everyone. My name is Princess Usong from College of Nursing Sciences, FCT. So COVID-19 has actually led to the push up digitalization in our classrooms today. Technology was once seen as a source of distraction by parents and all within, but due to the COVID crisis, the use of computer, laptops, tablets, cloud technologies has actually led to more information being passed to the student. And these things are no longer seen as luxury, but necessities in our educational system. And with the use of e-learning and ICT technologies in the classroom, we've been able to have more engaging learning environments where dull materials can actually be transformed into an interesting and fun activities for we, the students. And the teachers also could present their subject in a way that could be captivating to us all. And that also boosted this collaboration we have within ourselves. If an inexperienced student is finding difficulties using a technology, an experienced one could actually assist these ones. And this has actually built a connected community within the classroom. Moving forward, since technology, the pros of technology outweighs the cons, I expect that we have an additional educational technology tools and apps that will actually help us to interact more without any interferences. We could look at our platforms today. We had some interferences from other states. So if we have more educational tools that could clear up these barriers, to go a long way, and to also cut the effects, to bridge that gap between device and student ratio, there should be provision of classroom tablets so that we students can be at our own pace to work on our own, do our assignment, and the teachers can have that one-on-one instructional situation with us. And also that some educational technology grants that could be reinforced so that more softwares and hardware can be purchased in order for these learning objectives to be fulfilled. So I think e-learning has done a great improvement in our classroom systems, and even parents no longer see this technology as a distraction to us children, because before COVID-19, if my dad should see me carrying a phone, they just have that mindset that, oh, I'm actually browsing or I'm going into something offline. But during the COVID-19 with the lockdown, I was able to use my phone to go through my classes. And most times when they see that, oh, I'm not even with my phone, they caution me to tell me, where is your phone? Are you not studying online? So parents actually know the importance of this. And I would expect that some apps too should be given so that parents can manage their own emails and also receive some instructions from the school announcements also. Thank you.
Wow, wow. You know, so yes, and as growing adults, your parents no longer see it as if you're going to the bad sides on the internet, rather it's for educational purposes. Thank you so much, Team FCT. So Team Bauchi, I want to hear your perception about e-learning. What has been your experience and what do you want it to go going forward? How do you want to see it better in your school?
Okay,
Team Bauchi, please.
Good afternoon, everyone. I'm Abachi Dalailu from College of Nursing Sciences, HWM Teaching Hospital, Bauchi. My perspective with regards to technology incorporation in classroom is actually very much better. To cut the thing short, like this corona issue actually has brought about some positive development in educational sector, health sector, and somebody asked like, what is my perspective with regard to coronavirus pandemic? Like, does it do more harm than good or more good than harm to the society? Then I responded that, yeah, to my own perspective, coronavirus has actually did more positive than bad. And he asked me why. Then I say, looking with what coronavirus brought into our nowadays society, before, having known that there is a lot of causative organisms that are responsible for causing a lot of diseases, especially in the developing countries, there are a lot of health techniques like hand washing, social distancing that were neglected before. But with the COVID-19, you see people are practicing good hand washing techniques. wearing their mask when going to public places, social distancing, avoidance of unnecessary crowding, and a lot of those. So this kind of situation has actually improved our health status and help in prevention of disease actually. So I consider this as a factor that can actually brings about more healthy community in a nearby future. And it is of course due to the coronavirus pandemic that people realize the importance of this and that the microorganisms are everywhere and they have to wash their hands before and doing a lot of stuff. So actually this is the reason why I said that I consider coronavirus as something that has actually do more good than harm, to the health of our people. Then with regards to technology, with regards to technology, coronavirus actually has brought about a positive impact to our society that people.
So I want you to hold on, Team Bauchi. I want you to tell me going forward, what are the things you would love to see improve with e-learning in your school?
Sorry, ma, come again, please.
Where do you want e-learning? How do you want e-learning to improve in your school? How do you want it to improve in your school? Yes.
Yeah, I want actually the e-learning programs to be improved in our education institution. Like for example, in my school, we need a lot of computers. We need a lot of internet facility, access to internet, e-library, and a lot of more, because we need such facilities to enhance our learning activities, research, doing a lot of academic investigation, and a lot of more. And like with this corona issue that has come to place unexpected, with technology, a lot of us were able to cover the gap using online classes, such that their academic activities will not be disrupted. Having considering a lot of educational institutions, their academic calendars, their program were totally disrupted due to the total shutdown of activities, educational activities during the corona. So with appropriate technology in our educational institution, actually we will be able to improve our education and meet with the global standards. Thank you.
Thank you, Team Bauchi. So Team Ebonyi.
In addition to what
let's go to Team Ebonyi. Hello. Let's go to Team Ebonyi, please. Team Ebonyi. Team Ebonyi, please. Yes. So can someone respond? I want you to tell me from your experience with your teachers and your tutors, have they taken advantage of e-learning? And how do you want to see it going forward?
Okay. My name is Kingsley Okeke from Banyan University Academy. Responding to your question about whether our lecturers has taken advantage of technology, the answer is yes. And I must tell you that's the reason why it seems like our school calendar is a bit beyond those people that have not employed this technology, especially this COVID-19. Actually, during that COVID-19, we had all our lectures online, even quizzes, apart from exam. And the reason why we're not able to conduct the exam online is because many students are not connected, many students are not aware of it. So coming back again, I believe if something like that should happen again, our school, because students are starting technologically, they are aware of this. I believe if such thing, or if there should be a breach in the academic calendar, that our school will be able to fit in appropriately to the use of technology in both exams, quizzes, and lectures. And then again, we still need some strengthening and reinforcement in that technology, especially in this ICT. Of course, there will be an ICT lab where students will go. But if you look critically, you see that inside there, it's just few systems that are working. And also, if the information should be given to the team that always come for accreditation, for them to look deep, that all those systems they see there, it's not all of them that are working. They need to look into them. Yes, sometimes we cover this list up because the accreditation is for us. But as we're covering it up, we're covering the parts we will benefit from it. So the accreditation team coming, knowing that these things are necessity for accreditation, should take their time to go through these computers one after the other and then ensure it's working. And that thing is light. Without lights, you cannot be able to operate technology. But also, you see that when we have things like visitors, just like every other place in the country, when they have visitors or some dignitaries visiting, you see light everywhere. Yes, all of us will clap and we will respond that there's light for us to get accreditation. But critically, there needs to be an underlying investigation to know if this light we see today, that's how it used to be. So these are some things affecting our technology. And that thing is network. Network, you see that in some areas of the country, MTN be the dominant network. Some students that have Airtel, IT Salat and all of that, they will not be able to sit appropriately. So if there will be a way to strengthen these agencies like Airtel and all of that, for them to have adequate network for students to enjoy this technology.
I hear you correctly. So the accreditation team, they should look beyond what they are seeing on the surface and ensure that the computers for the students are working. Wow. So accreditation team and those who are involved, who are in this platform, especially across our states, please hear that from Ebonyi. Okay, so we're going to move on to the next perspective, looking at barriers to health services. So I'm going to start with Team Sokoto. Barriers to health services. As student health workers, we are also recipients of these health services, and also we shall be future providers of these services. So I want to ask you, what do you think as future health workers, what will be the contribution to mitigating the barriers at the rural and remote areas? From the perspective of being future health workers, how do you think you'll be able to mitigate the barriers to health services, especially in rural areas? Team Sokoto, please.
Good afternoon. I'm Nkiru Chukwuka from Woodwood School of Midwifery, Sokoto. What I think is accessibility, which is one of the barriers to attaining health in the rural areas. You find out that most of these health facilities are either far from the community, the inhabitants there, or they don't have transport to go to these health facilities. So if these health facilities can be built maybe 5 meters away from every household, that will improve their access to health facilities, and also making it possible for the health workers to actually visit the homes of these inhabitants, doing treatment and also follow up.
So my question is, so as a future health worker, how do you think you will contribute to mitigating this barrier?
Well, as a future health worker, I think if duly employed in such settings, I would, if duly remunerated in salary and being provided with the basic social amenities, I would like to work and send my report, and also if supervised by the superiors, to make sure I'm actually doing what I ought to do. That would help the commutants in attaining their health care. And also when it comes to providing my basic amenities, I wouldn't like if I don't have these amenities, and if I wouldn't want to be subjected in a place where I'm not cared for, I'm sure I wouldn't render such services to them.
Okay, I hear you. I hear you. So required amenities as a future health worker will make you to be able to support to mitigating these barriers. So I want to hear from FCT. When we talk about the FCT, like I said in our opening statement, that FCT is a cosmopolitan city. However, we have a lot of rural and remote areas within the FCT. So can we hear some of the barriers that we're experiencing within this city, and what you will contribute as a future health worker?
Okay, good afternoon, everyone. My name is Chuku Deborah Oge Chuko. So one of the barriers I'm going to be talking on is culture. We all know that culture in Nigeria is like our heritage, and culture is as long as it has existed, like for human existence, is as long as human existence. So culture, on the other hand, has done more harm than good towards health-seeking behaviors. There are some cultures that will not permit their pregnant women to deliver in the hospital because they have this phobia that if these women are if they give birth in the hospital, like their conditions or the problems which they had before going to the hospital will increase. There's also this cultural barrier that prevents children and pregnant women from eating what they're supposed to eat to make themselves and then their children to be healthy. Take, for instance, eating of snail. There's this cultural belief that if a woman eats nail while she's pregnant, that her child will be drooling saliva while he's growing up, or will be very slow when it comes to walking. These are some of the cultural barriers that are actually affecting healthcare.
So how will you contribute to mitigating it?
Okay, as a healthcare worker, what you need to do is education and enlightenment, because if these people have proper education about actually do better when it comes to health-seeking behaviors. And also community mobilization is very key, because when we are involved in something, we have good knowledge about these things. Like if you get the communities involved in health-seeking behaviors, I believe you have positive outcomes when it comes to health-seeking behavior. Thank you, ma'am.
I want to go to Kebbi. Kebbi, what are the striking, looking at your environment, what is one of the critical barriers to healthcare services in Kebbi State? And as a future health worker, how do you think you contribute to mitigating it? Kebbi, please.
Thank you. Good afternoon, everyone. My name is Bilkis Abdullahi Dika, and I'm from Kebbi State College of Nursing Science. So one of the barriers that are like those barriers that hinders access to healthcare, I think one of them is language barrier. Because, for example, now if I go to the hospital and the person that's in the hospital, that person cannot even understand what I'm saying, the next day I'm not going back there. So what I want to say here is that those people in the hospital, for example, if you are going to Saudi Arabia for maybe like you are going there to work for them, you must stay at least 1 year there to learn their language first, then before then you can work for them. But here in Nigeria, the talk is otherwise, because you just see them coming without understanding the language of the people. And if the people come here and start talking to them, those people will be like, they are not understanding that language. So that's the barrier. And the best strategy that can break that barrier is you have a translator, someone sitting there close to you, someone that know that, yes, he understands that language. So if that person is talking, that person can translate the language to them, and the healthcare access, we can have it like that. Thank you.
Thank you. I hear you. Looking at language barrier, where the health workers do not understand the local language and not able to, provide the necessary answers to the community people. And that can be mitigated when we learn the language of the people. So we're going to look at one of the other issues that we have, and which is, bonding. I know some of you have heard the word bonding, the phrase bonding, where health workers are persuaded by contracts, sort of, to stay back in the communities and to provide services, especially when they are provided with some stipend or some scholarship program. However, this is the jet age, and all of us are young people that are going to be future health workers. So I want to hear your perspective about bonding. If you're provided with scholarship and you're asked to sign a contract that you will stay back, especially for nurses, for 2 years to work, will you sign? Will you remain, or will you, break the contract, or even not accept the scholarship offer? So I want to go start again with Ebonyi. So for nurses, if you were asked to stay back, will you do so, especially if you are under a bonding oath? Please go ahead, Ebonyi.
Good afternoon. My name is Ebonyi from Banyan University. So, over the past year, I know, using Alex Ekema Federal University Teaching Hospital as an example, many of them have migrated. They lack a lot of nurses there. So I basically think that the reason for the migration is mostly because they are not paid well, actually. So in a situation where there are attractive offers that if you stay for this particular amount of year, I will increase your salary will increase, and it will be steady, because there's every tendency that after being promised this salary, after being promised this amount of money, this price, this trophy, it will still not come to pass. The issue of this ASU and federal government issue to society anyway. But I feel that if the nurses are paid more, provided with what they need to work more, and also this nurses victimization in the hospital by other colleagues like the doctors, the radiographers, and the med lab scientists, actually, if that is a stop to that, if you put a stop to that, actually, give them a platform where they can air their voices, include them more in the hospital politics, and also make sure their salaries are assured. I think many of us will see no reason to migrate, because what we actually need to work is being there. Our psychological health, our mental health is in check, because what we need to work in the hospital is actually being provided for us. Like as a student nurse, I went over to my clinical postings and I saw some of the things that honestly, if I'm asked to stay back, I will not, because the things I need to use and work, like some of these nurses in the world have to sell snacks to subsidize like what they are being paid in the hospital. And they see a situation where they are able to migrate and be paid more and being treated with respect by their medical colleagues. Nothing will make them stay back, because they're actually seeing what they want outside there. So that's my own take on that. Thank you.
Thank you, Team Ebonyi. I hear you, hospital politics, the work environment politics, nurses need to get involved. However, I'm still going to ask Team Bauchi again. If you were asked to sign a contract that you will remain 2 years in the community where you have been trained, will you honor that contract? Or will you break that contract?
Thank you very much for the question. Good afternoon, ma'am. I'm Moko Ebe from College of Nursing Sciences, HWM Bauchi, Nigeria. From my own point of view, I would say we should check the what's it called, the definition of scholarship. Actually, it's more or less like a financial assistance that is being given to students in order to further their education. So from my own point of view, if actually this money is actually consistent, like the issue we have here in Bauchi is because you as a student, you are entitled to some certain amount of money, and after which will be kept, that's the bond for a period of 2 years. But then the problem you get to find out is that this money, so-called scholarship, it's not really consistent. And then you now tend to find out that students probably sponsor themselves, or their parents sponsor them. And still, at the end of the day, they'll still tell you that you still have to come back for that 2 years again to serve, which is not really fair on the part of the students. If actually the money is to be consistent as it's being laid down based on the rules or based on the so-called bond like that, it would actually be better, because for some people, they depend on that money to sponsor themselves throughout the period of their schooling. But then in the case where the money is not there, seriously, it's not going to be easy for somebody like me personally. I won't really probably go through the period of the school without the money, and then at the end of the 2 years, you now tell me to go back, and then you now find out that most of the places they will post them to is not even favorable. You posted to rural communities to stay for a period of 2 years. You go to places where there are no lights, where there are no good water supply and all of that. But if actually the government is to renew this, and then there's the scholarship is actually regular, and the students are being paid when they are to, and then also it's consistent throughout my period of 3 years, then I'll see it as a period, as an opportunity, because after I graduate, the issue of going out there to look for jobs and all of that won't be there for me to bother about, because once I graduate, I'm so sure I'm going to get a job. And then another thing there is that the places where they are being posted to, it's not favorable sometimes, because you find out that some people are being posted to rural communities where you have some language barriers and all of that. And then that's also another challenge too.
Thank you so much.
Nevertheless, in addition, this bonding has a positive side on individual and also to the society. For the individuals, it helps students to master their skills more, and it helps to increase the relationship between the health workers and the society. And also to the society, it has a benefit to the society too. That is, this issue of lack of healthcare professionals in the villages, this issue will be eradicated, because there will be constant supply of students every year. Every year, students are graduating and they will be sent to villages. So it has a positive effect when these are being put in place. Thank you, ma'am.
Thank you so much. So finally, Team Sokoto, can you conclude on this matter about bonding, about, you know, the contracting and honoring the contract as future health workers? Will you honor a bonding contract with what you know now and with the issues of human resources for health in Nigeria? Sokoto, please go ahead.
Good afternoon, ma. I'm Halima.
I give you 1 minute to respond. Yes, 1 minute.
I'm Halima of Madam Folio University Teaching Hospital, Sokoto. I will honor the contract because we have been complaining a lot about low level of healthcare worker in the community. So if I'm opportune to be given scholarship and asked to work there, I would work because this will go a long way to reduce that problem. Another issue regarding that is that as a student, there are a lot of things I will gain from it. Because after that, my school, I will be able to kind of improve my learning ability within the community if I'm opportune to work for that 2 years. So I will gain more skills within that time duration. So I will be honored if I'm given the opportunity to work in the community. Thank you.
Good afternoon, I'm Juliet Joseph.
Yes, so FCT. Okay, go ahead.
From School of Sokoto. Well, for me, I would say if the statement of the contract will be kept as promised, I will accept the offer. But if this statement cannot be kept, or after accepting the contract, there is some deformity or some problem with the contract, to me, I would say I won't go if there's no conducive environment, high payments, and standard living of life. Thank you.
Thank you so much. So I want to come to Team FCT. This is where we will begin to round up. We have about 5 minutes to go. So Team FCT, I want to hear your perspective about the bonding, and will you remain, will you honor the side of the contract with what you know now, you know, looking at all the issues that we have discussed? And after that, our technical director, Olufolake Akeju, will give us the concluding remarks for this global event. Thank you so much. So Team FCT, please.
Okay, good afternoon. I am Mohamed Asmau from FCT College of Nursing Science. Thank you for this question because I want to say my personal experience. I was one posted to Kwaku community in FCT. That was during the midwifery service scheme, which was a 1 year bonding. It was a 1 year bonding after midwifery school. So I was posted to that community. It was a remote area where I had to take bike for 2 hours. The roads are not motorable. You know, there was no network for me to even speak to my people. So I had so many challenges in that community. And what kept me working as at that time was that when I look at those people in the community, when I look at their situation, I pity them a lot and I feel I should continue. And then secondly, then we had so many NGOs coming to give us workshops, and they were ready to pay. And then the local governments were also paying, states were paying, and then the federal government. Let me just say that the hygiene factor is the main thing. If people posted to the communities are well paid, I think many people will want to stay back and serve the community. But when they are not well paid, coupled with the security we have. Thank you.
Thank you. Yeah, so I hand over to Folake, please. Folake, please, can you conclude this meeting and appreciate everyone who has joined us all over the world, especially our students from across our HWM supporter states. Thank you. Over to you, Folake.
Thank you very much, Uche, for the excellent facilitation. Good morning to our colleagues in the US, and good afternoon to everyone in Nigeria. I'd like to say a very big thank you to the organizers of this webinar. Thank you, Banyan Global, and to all our Banyan Global staff in our US office. I also want to thank all the schools represented here in all our states, in Bauchi, Ebonyi, Kebbi, Sokoto, and the FCT. Thank you so much to the tutors, to the management of the school, and also to the students. Thank you for honoring our invitation. It shows that you value our partnership and you also value the support that we provide to your learning experience and to the delivery of learning to the students. That's for the tutors. Concerning the discussions that we've had, we've discussed extensively over various topics. We've discussed about brain drain. We've talked about mitigating barriers to health services, bonding practices for healthcare workers, and our decision to become healthcare workers, the motivating factors. And we've also talked a bit about ICT and e-learning that has improved due to the COVID-19 pandemic. Over the next few years of the project, the Health Workforce Management activity is committed to working with other partners to ensure that we intensify our advocacy efforts to the state government to recruit and deploy qualified healthcare workers to primary healthcare facilities. We're also taking the lead to ensure that we advocate to state governments to provide the necessary amenities in the rural areas. While we may not be able to commit to having primary healthcare facilities established 5 meters or 5 kilometers away from where where people live within the rural communities, we will advocate for the establishment of primary healthcare facilities within rural communities that are accessible to the population that reside there. We're also working to ensure that e-library facilities are provided to students, and that's something that we encourage you to take advantage of in the coming months. We're providing e-library facilities to all the schools that we support in all the states, in the 4 states and in the FCT. And we're also exposing the tutors in your schools to 21st century learning teaching resources, which we also want you to take advantage of. In addition, we're supporting the schools to provide teaching aids and learning aids that will improve your learning experiences. So in the coming years and in the coming coming years, we expect that you will take full advantage of all these things that we're providing to your schools. So in summary, on behalf of the Health Workforce Management activity, I'd like to say a big thank you again to the organizers of this webinar and also to everyone who has participated. Thank you for the discussions and thank you for being here and for honoring our invitation.
Thank you so much. So bye everyone, bye. Bye, and thank you for joining us. Bye. Thank you all the students. Thank you HWM team from the US, from Nigeria, and all our friends that joined us. Bye.